I'm Melissa.
I'm Donna. I'm her mother.
I'm her daughter. And we are Seriously M&D. Welcome back to our channel. And today we are actually going to be talking about, since it's the first week of October, we're going to be talking about Breast Cancer Awareness Month and Making Strides Walk, which is something that we are doing in Las Vegas, donating our time, and we're trying to raise money. And so for people in Las Vegas, the Making Strides Walk is more specifically for you, because we're going to give some information on how to sign up for the walk and how to donate if that's something you're interested in. But if you don't live in Las Vegas, or you don't have time to walk, you can also donate too, and that is greatly appreciated.
I noticed the last episode that this camera can really pick up the volume, so you're going to be hearing the fan in the background because our kids are napping. And I noticed also that my bracelet was annoyingly loud the last episode, kept hitting the table. So I'm going to be like this.
You're probably the only one that noticed that.
You noticed, didn't you? I know you did. No. Anyway, moving on with this great, worthwhile cause, I checked out cancer.org because that's what Melissa said to research on the computer. And when I did, there is a plethora of information about cancer, but if you click on the breast cancer tab, there's so much on there. And from a personal standpoint, when I was 29 years old, I went for my annual visit with my gynecologist, OBGYN, who was the doctor that delivered my 3 children. He is no longer the doctor that I go to. He retired. And he found a lump on my right breast, and he was so cavalier about it. But that was his bedside manner. He had trouble with his bedside manner, but he was really direct, and I value that now. At the time, I was like, oh, but he did do a breast check, and I was not good about self-checking. And he found a lump on the nipple, and he was very matter of fact. He said, okay, there's a lump here at the 3 o'clock on your nipple. You need to go have it checked with the surgeon and see what you want to do. And I was like, ah. And I'm sure some of the information I'm going to share is what people who are going through breast cancer, when they find out they've been diagnosed with it, may have some of the same things that I was thinking. I couldn't believe it. I was 29 years old. So I did find out that I have fibrocystic breasts, so I'm very lumpy. And I went to the surgeon that he recommended. He was wonderful. And he said to me, Donna, you can do one of 2 things. He went in and thought he could aspirate, but it wasn't fluid, it was a cyst. He said, we can watch it and see if it gets bigger, or we can remove it. And because I was a worrywart, and he did say, because you are a worrywart, he said, let's take it out and do check it in pathology. But long story short, it was benign. But thereafter, I had mammograms every year, and then I was able to go every few years, and then when I hit 40, it was every year. So I'm still fibrocystic breasty and lumpy. But that one doctor, before he retired, he was checking me, and I said to him, man, you are so rough. Why are you so rough with me? And he said, here. He gave me this silicone breast. And he goes, feel it. And I just felt it. And he goes, no, feel it. Push harder. And I was pushing down hard, and there were like little rocks inside. And he goes, that's why I'm rough. I have to feel very deeply in there to see if there's any lumps. So I said, okay, I get it. But I mean, he thoroughly checked everywhere. So I was thankful for that, and I thank God
That they have it.
Yeah,
Stuff to...
because when after I went to Dr. Pointer and he said I found a lump, then I went and had an ultrasound. And then after that, I went and had the mammogram, and then I went to the surgeon. So that was the protocol and how I followed.
And after I had Kennedy, I had the same thing. My doctor, maybe.
Yeah, and that's
my doctor.
That's who we go to
and
now.
I actually randomly noticed it, and then I started freaking out. So I went in, he checked it, he thought it was a cyst, and then I went and got an ultrasound on it, and they didn't want to move further with anything, but they kind of taught me how to keep an eye on it and, you know, doing your self checks. So I've been trying to do those and be aware and not panic when, because for me at least, when you do try and check, I overthink, you know, so you have to stay calm.
And another thing is if you have any family history. So my mother had breast cancer, but after she had gone through menopause, and that's a big difference. Her mother had breast cancer after menopause. So every time I go and I have my mammogram, which I went to the doctor today, my mammogram will be now in November, because every year, you know, it gets push from the year you go in for your annual. So when I go in November, I'll fill out that paperwork and they'll say your last mammogram and is there any history in your family? So yes, there is history, but both, thank goodness, my mother and her mother both had it after menopause. So when your hormones have changed. Now my mother-in-law, my husband's mother, who just passed away recently, she was diagnosed with breast cancer when she was 50. So, and she took care of herself. She found her own lump. So just to be aware, because I have friends that haven't gone in and had their mammograms and they're over 40, and I don't want to be preaching to anybody. I'm just thinking, I know from experience, and I know that it's in my history is in my family. But some of the things on the website that are really informative, and you can check it out, they've broken it up, and I think I'm referring to my notes down here, so don't think I'm being
And we'll
boring.
put the website right here. It'll come up on the screen so that you can go and you can do more research. I also know my mom did mention that cancer.org has information about a bunch of different things, and we're just specifically talking about breast cancer today.
Right.
So, and in the future, I think we might do different awareness episodes, but today we're talking specifically about that, but you can research other areas too.
Oh. The first topic is about breast cancer. So they have breast cancer basics, and it really is very user-friendly, the computer, this program. And they have PDFs at the end that you can go on. It's almost like a PowerPoint that you can go on and go down and,
that's nice.
and look and see. So it's, you know, basics, and there's drop-down signs and symptoms of possible breast cancer. Swelling, skin irritation or dimpling, breast or nipple pain, nipple retraction where the nipple goes inward, redness, scaliness, thickness, skin on the breast tissue, and then nipple discharge. We're not talking about when you're nursing, that kind. The second topic was breast cancer risk and prevention. Risk factors, can breast cancer be prevented? So they had a bunch of information that you can check out there. The third topic was breast cancer early detection and diagnosis. Can breast cancer be found early? Imaging tests to find new breast cancer through biopsy. I know they have a big genetic thing. I know that the actress Angelina Jolie, her mother had breast cancer, so she went on and checked out, you know, herself, and she was, you know, possibility of getting it later on in life. So she did some stuff too, so you could check that out. The fourth topic was understanding a breast cancer diagnosis, types of breast cancer, prognosis, the stages you go through, and then the prognosis after, questions to ask about your particular breast cancer. The fifth topic, the breakdown was treating breast cancer, local treatments. Do you go the surgery route? Do you go radiation? My mother, when she was diagnosed, she went for the radiation, and I remember taking her to some of her treatments, and then after the fact, and just her showing me how red, it just looked like a terrible, terrible sunburn after she had it. And then the marks, you know, the X's where the radiation is given. Chemotherapy, hormone therapy, targeted therapy. Those are just different treatments that are options for the patient. How treatments are approached, who treats breast cancer, making treatment decisions. There's a bunch of information on that particular subtopic, the treating breast cancer. The sixth topic, breast reconstructive surgery. Deciding whether, if you're going to have reconstruction. And my mother did have a friend who had reconstruction, and the implants just didn't work. Our body rejected them. So stuff like that you want to know about. The seventh thing was non-cancerous breast conditions, and that's what I went through. The fibrocystic breast disease, that's what I have. And so many people have it. When I tell my mother that, she's like, oh yeah, I have cysts all in my breasts. So I'm not sure if that is genetic, inherited, and you said you have it. And the last thing is living as a breast cancer survivor, the emotional part, the concerns after treatments. Like I said, at the end of the website, it does give you the PDFs that you can click on and go down, and just gives a bunch of information. So it was really informative.
And with Making Strides, I've been involved with this charity for the past few years, and I've helped when I was working. I helped them organize this to help with fundraising. So I just wanted to really quickly read off where the money goes that is raised, because if it's $1 donation or if it's a $10 donation or a $100 donation, all of it matters and all of it counts. So it says it goes to breast cancer research, it goes to Road to Recovery and other transportation programs. So I know that it says provided over 300,000 rides to treatment. There is also called a Hope Lodge, which is nearly over 400,000 nights of free lodging provided. 24/7 cancer help. There's a cancer help hotline. And then there's also patient navigators, which is more than 40,000 patients served. So this is nice because it shows you that the money being raised and the efforts going into this fundraiser, it is being dispersed, and it all has a reason and a point for it. So also I wanted to mention that the walk for Making Strides in Las Vegas, Nevada is on October 28th, 2018, which is a Sunday. Registration starts at 7 a.m. and then the walk is going to start at 8 a.m. And then we have a team that we've made up, which is called Seriously M&D. So if you are interested in signing up to be on our team to raise money, you can go to makingstrideswalk.org, and then you click join a walk, and then it'll ask you to register and create your own profile. And then you can go in and you can click to join the walk in Las Vegas. And if you'd like to be on our team, help us raise money for this great cause. And I know my mom did go over a lot of information, but please check out the cancer.org website, because there is a lot of resources on there that I think sometimes people don't know about and are aware of. And I think sometimes when people are told maybe go online and to go look at something, you're kind of deterred because you don't even want to deal with it. But I'm glad you said it was user friendly.
Very.
So that's nice. So, but they have so many PDFs, so many, even like if you wanted to print these for work or print them for yourself, and I know also they did mention that at the walk, for anyone that would be interested in coming to the walk, they're going to have a bunch of different stations. So, for people bringing awareness, it's a very kid-friendly event also. I've taken my daughters to it and we've walked. So, and it's at Red Rock Casino. So I'm going to actually post a lot more of this information on our Instagram. Give you guys a link to copy and paste. I'll put some more of this information at the end of the video if it's something you're interested in. But what we hope that you take from this is the awareness portion of it. The raising the funds, that's amazing. And taking the awareness from it is what we want you to be able to benefit from.
And I think cancer alone, but breast cancer has touched so many lives. So we know you're out there, and we know a lot of you have loved ones that are experiencing this, or you are experiencing this, and we are here for you for support.
And we're here praying for you and for the survivors. You are in our thoughts, and even though we haven't personally met you, we applaud you. We applaud you. It's a big thing to be told that and to go through it, and your family to go through it. And we wanted to come on here to just raise awareness and bring it to people's attention, because I think when it comes to wellness and preventative care, a lot of people don't take advantage of the things that are free, and this is free, and you can learn and gain knowledge and check yourself and be aware. So if you do have any questions for us, you can go on our Instagram at SeriouslyMND. If you want to direct message us. If you have any questions about the walk, or you want to know how to get involved, or if you have questions about finding certain links, please direct message us. We'd be happy to help you. And don't forget, it's seriously okay to be you.